A mastectomy, the operation to remove a breast, has two parts to it from a plastic surgery point of view. It has a part where the skin of the breast is removed, and it has a part where the breast itself, or the volume of the breast, is removed. And therefore, in any type of breast reconstruction, as a plastic surgeon, we have to think about replacing the skin with skin from somewhere else, or stretching up skin to account for the skin that's been removed. And the volume that's been taken away with the mastectomy has to be accounted for in a reconstruction, whether that's through an implant being used to give the volume, or through muscle and fat being used from somewhere else in the body to give the volume. And if you understand breast reconstruction from that point of view, the concepts of the different types of breast reconstructions become easier to understand.
If you can think of a breast not as a breast, but as a skin envelope and a filler inside it, so these are the two things a surgeon needs to look at to replace. In an immediate scenario where pretty much all of the breast skin is preserved except for the nipple area, then a patient can have just implants only or a tissue expander. Whereas in a delayed scenario where there is no breast skin, the chest wall is very flat, one has to bring in skin from somewhere else, another part of the body, to give the skin envelope, and then obviously think of a filler inside it, which can either be an implant or can be the patient's own fat from elsewhere. You can use the muscle from the back, which acts as a carrier for the skin from the back. That's brought forwards, and then an implant's put underneath to give the volume to the breast. So that's one place tissue can come from. Other parts of the body that can be used to make a woman's breast using no implants, just her own skin and fat, and sometimes occasionally a little bit of muscle, is the tummy. So that's a 2-for-1, a tummy tuck and a breast reconstruction. So using the skin and fat, the roll that one has below the level of the belly button, use that to make a breast. Another place that can be used is the inner thigh. You know, the inner thighs, when in the summer months they rub together, that's the bit we're interested in. It's like taken in a shape of a curve from the inner thigh and folded to make a cone and used to make a breast. These two areas, the tummy and the inner thigh, are soft fat, so they are very natural shaped breasts, whereas buttocks can be used as well, but that the fat on the buttock is a bit more firmer, so it gives rise to a more firmer breast.
I call it small, medium and large, and that's not related to the size of breast that we can make. That's the effort that she will be putting in and that I'll be putting in to make a breast mount. And so I tend to see a lot of ladies in my clinic who want their tummy used for reconstruction or their inner thigh, rather than relying on a reconstruction that requires an implant. So I would probably, out of all the reconstructions I do, probably 80% is using the tummy or the thigh. 10% will be used an implant on its own, and then the last 10% I would combine it with the muscle from the back.